Assalamualaikum warahmatullahi ta'ala wabarakatuh. Salam sejahtera and a very good day to everyone. Firstly, I would like to thank the organizing committee for inviting me here today, and it is a pleasure to be talking to all of you today. Allow me to share on the COVID-19 pandemic in Malaysia. The first case of COVID-19 in Malaysia was detected in January 2020. And 2 weeks after that, the first Malaysian infected by this deadly virus was reported. Following that, the number of cases grew up rapidly, with few clusters all over the country were reported. Due to this situation, the government of Malaysia at that time announced the first lockdown on the 18th of March 2020. So, what is the impact to our hospital? Allow me to introduce Hospital Chancellor Tuanku Muhriz, or in short, HCTM. HCTM is the teaching hospital for Universiti Kebangsaan, Malaysia. It is a tertiary hospital with the capacity of approximately 1,000 beds. As per pandemic, our hospital was declared as a hybrid hospital for COVID-19 on the 12th of March 2020. During this time, we allocated 20 ICU beds and 250 beds for the COVID-19 patients. As for us, the healthcare workers, we were very much affected by this pandemic. We experienced few outbreaks in our facilities involving our healthcare workers. This caused an increased workload for our staff, as those infected have to be quarantined for 14 days at that time. As a result, there were tremendous amount of anxiety, feeling scared, and overwork for the healthcare workers. Vaccines for COVID-19 was only available to the world almost a year after the pandemic. As for in Malaysia, the first batch of vaccines reached Kuala Lumpur on the 21st February 2021. Following that,
Dr.
the
Hanita,
government of Malaysia actively vaccinated the people.
I'm sorry
it was
to interrupt.
done in phases, and the healthcare workers was given.
I'm sorry, Prof. Hanita. Can you put your screen to share to the slideshow, please? Because we can actually see the smaller slide as well. So, is it possible for you to switch your slides to the slideshow?
This is pre-recording, so can the organizing committee?
Okay. My apologies. In that case, please proceed. Please proceed. Thank you.
The first priorities. Taking into account that our healthcare workers is in the high-risk group and whether the vaccines will really protect them, we conducted these studies to look into the SARS-CoV-2 spike protein antibody titers in frontliner healthcare workers before and after COVID-19 vaccination. Allow me to make a statement of disclosure here, whereby during this study was conducted, there were much uncertainties on COVID-19 infection as well as the efficacy of the vaccines. A bit on the COVID-19 infection. As we all know, COVID-19 is caused by the SARS-CoV-2 virus. SARS-CoV-2 virus has 4 essential proteins, including the spike or S protein, the matrix M protein, the envelope E protein, and the nucleocapsids N protein. The receptor binding domain, or the RBD, on the S1 subunits will bind to the ACE receptors in the host cells and started the infection. Healthcare workers are at risk of developing SARS-CoV-2 infection and spreading it to others. To reduce the number of COVID-19 cases, the morbidity as well as the mortality, Malaysia introduced a mass vaccination program. One of the vaccines that is being widely used in Malaysia is the Pfizer-BioNTech vaccines. The Pfizer vaccines was developed based on the spike protein as well as the RBD in the S1 subunit of spike protein, which is found in the virus itself. The vaccination will induce the formation of antibodies against the spike protein, and hence quantitative serology testing against the spike protein has been developed to observe the antibody response after the vaccination. So the aim of our study is to determine the SARS-CoV-2 spike protein antibody titer before vaccination, 3 weeks after the first dose of vaccination, and 3 weeks after the second dose of Pfizer vaccination. As for the specific objective, we want to determine the number of healthcare workers with positive SARS-CoV-2 spike protein antibody before the vaccination, to observe the pattern of antibodies before and after vaccination, to determine the adverse reaction after the vaccination between the first and second dose of vaccination, and to observe the occurrence of COVID-19 infection amongst those who received the vaccination. We conducted a prospective studies involving our healthcare workers receiving the Pfizer vaccines. We took 3 blood samples. The first samples were before the vaccination. This is as a baseline. And we took a second sample that is 3 weeks after the first vaccination. And the third sample is were taken 3 weeks after the second vaccination. The participants will follow up for 7 days post-vaccination, and they are required to fill up adverse reaction form. As for the antibody testing, we use Elexis anti-SARS-CoV-2 as antibody with the detection limit of 4 to 2,500 micromoles. As for the results, the total number of participants is 243, and this is the participants' general characteristic. You can see that the mean age for this participant is 35.7, mainly female participants. Most of them are they were doctors, and it is there were 4 participants who had history of COVID-19 infection prior to vaccination, and there were also 4 of the participants who developed COVID-19 after the 2 vaccinations. Figure 1 and Table 2 demonstrate the level of SARS-CoV-2 spike protein antibody titers before vaccination, that is the baseline, after the first dose of vaccination, and after the second dose of vaccination amongst the participants. The general linear model or GLM analysis demonstrate a significant increased trends of the SARS-CoV-2 spike protein antibody throughout 3 different phases: the baseline, the first dose, as well as the second dose. Figure 3 shows the comparison of antibody titers between the group of participants diagnosed with SARS-CoV-2 infection prior to vaccination and those without disease. The GLM findings reveal a significant difference in the antibody titers between these 2 groups. It is interesting to see that those who had prior infection showed a higher level of antibody titer response compared to those without the disease. The result was similar after performing the Mann-Whitney U test to compare the mean SARS-CoV-2 spike protein antibody titers between these 2 groups. When we look at the vaccination side effects, the majority of participants develop mild pain at the site of injection. The reaction at the injection site is more pronounced after the second vaccination. These findings were also observed for other side effects: limb adenopathy, limb edema, localized facial edema, fever, and chills were more pronounced after this during the second vaccination. As for flu-like symptoms, fatigue, malaise, again, post-second dose symptoms were more pronounced as compared to the first dose symptoms. From these studies, it has shown that all healthcare workers develop spike protein antibodies following the first dose. Following a second dose, almost 55% of the healthcare workers had elevated spike protein antibody titers, which is more than 2,500 mil, and this is the highest limit of detection. The healthcare workers diagnosed with COVID-19 prior to vaccination had a higher antibody response as compared to those without the infection. 4 or 1.6% of our healthcare workers developed breakthrough infections. 3 of them were in category 1 and 1 was in category 2. Local and systemic adverse reactions were more prevalent amongst following the second vaccination. So in conclusion, the BNT162b2 Pfizer BioNTech COVID-19 vaccines, which is a mRNA vaccine, is effective at eliciting a high titer of anti-S1 after second dose of vaccination and able to reduce the severity of infection in those with breakthrough infection. The vaccine's adverse effects are tolerable and no serious adverse reaction was seen in our participant. These were the two scientific evidence of this study. But at the same time, we also assured our healthcare workers that these vaccines can protect them from the severe infection, and this is their anxiety. These are the references, and I would like to end my talk today by thanking the Faculty of Medicine, Universiti Kebangsaan Malaysia, for providing the grant for this research, Hospital Chancellor Tuanku Muhriz for providing supports in terms of analyzing the samples, as well as providing us with all the disposables, Roche Diagnostics Malaysia for providing the kits for method evaluation before the studies is involved, and we would like to thank all involved in the study, especially our healthcare workers. With that, I thank you.